My name is Urs Meyer. I'm an associate professor at the Institute of Veterinary Pharmacology and Toxicology at the University of Zurich. And I'm speaking here on behalf of the awardee, Joseph Scarborough, who was a former PhD student in our group. And so we're working in the fields of behavioral neurosciences and pharmacology. And we're mostly interested in animal models of neurodevelopmental disorders. Now, we use these animal models in order to address the questions of how certain environmental adversities can shape brain development and behavior, but we also use these animal models to test new pharmacological treatments against these disorders. Joseph developed and validated a novel oral administration method that can be used for small laboratory rodents such as mice. And it is termed the micropipette guided drug administration procedure, quite a long name, so in short it's called the MDA procedure. And he has shown that in various experimental series that this method can be used as a non-invasive and minimally stressful alternative to the current gold standard, which is at the moment still oral gavage. And as you may know, oral gavage means that it's an involuntary insertion of a feeding needle into the oral cavity, into the stomach, and as such obviously is invasive, can be very stressful to the animals and can lead potentially to tissue damage. And so novel techniques are urgently needed, especially for chronic and oral pharmacological treatments in small laboratory animals such as mice. And the main principle is actually quite simple. It is based on the presentation of a palatable vehicle solution, which takes the form at the moment of sweetened condensed milk solution. And because of its palatability, animals without any sort of manipulation, such as food restriction and so forth, voluntarily ingest that solution with minimal training. Sort of development of the MDA method has practical impacts or significance, especially for the refinement aspects of the 3 Rs. As such, it will refine existing procedures. Mostly we hope to establish, in some settings at least, the oral gavage, which is much more stressful than the MDA. Yeah, with further establishment and dissemination of this MDA method, we're pretty convinced that it will be a very good alternative or addition to the oral gavage, and therefore will have practical significance, especially for the refinement aspects of the 3R principles. I think the challenge really is to boost awareness, so that there are new techniques, especially in our domain, which will be novel administration techniques. First, people might not be aware that novel techniques exist, but secondly, as compared to validated procedures, like those procedures that exist for a long time, new ones may not be as validated thoroughly. So I see it very important for the field to advance 3R in general, that we thoroughly validate new techniques using really sound scientific research in order to sort of convince people that these new technologies are equally valid and reliable as the old ones. Namely, I think it's very important that we can convince other researchers that the new techniques are scientifically solid. And on the other hand, we'd also like to disseminate the MDA method more thoroughly. And we will do so in collaboration with various organizations. And also in general, I think it's important to try to extend the applicability of the MDA procedure to various research fields. So far we have done it mostly in the domains of behavioral neurosciences and neuropharmacology, but we'd like to see whether the MDA procedure can be used as a valid oral administration techniques in other research domains.